Doctor, I know you got the vaccine today. Congrats, and thanks for setting the example. Help us understand this part, Doctor. Of all the vaccine doses available in America, only 13% have been administered. Why?
Well, let's understand this is a pretty challenging logistics situation. It's only been about 10 days since FDA issued its emergency use authorization for Pfizer and more recently for Moderna. Those doses then have to be shipped to the states because the states are responsible for figuring out then how they're going to administer those following CDC's recommendation.
So this is on the states?
The states have their job to do. Again, let's be a little gentle here with complaining about the logistics. I think to get this number of doses into a system where arms start to get injected, it takes a little more than a couple of days. And we've only had about 10 days since this began to be possible.
It's the great news from Meg Terrell just a minute ago on 100 million more potentially doses from Pfizer. Can you give us more information on this? Because I know people are like, I want my shot.
Well, it is good news that it sounds like it's very likely we'll have 400 million doses between Pfizer and Moderna by about June or July. But again, remember, these are vaccines that require 2 doses. I got my first one today. 28 days from now, I need to get the second one in the Moderna dosing. So that 400 million doses, as Meg just said, 200 million people. We are quite hopeful, though, that not far behind are 2 other vaccines. And she mentioned those as well, one from Johnson & Johnson, one from AstraZeneca. They're very late already in their phase 3 trials, pretty close to enrolling everybody they're going to test. And it would not be surprising if we begin to see readouts from those trials in January or early February. And those are actually vaccines which, if they turn out to be safe and effective, can be manufactured at scale quite rapidly. So we might just get there where every American could have access to a vaccine by the summer.
Fingers crossed, Dr. Collins. A question about this variant in the United Kingdom. I don't want to make more out of this because the last thing anybody needs is more stress. But we've heard from doctors today that they believe it may spread more easily in children. And Dr. Gottlieb and others say they believe it's already in America. 2 questions. Are you concerned about this kids part and whether they could spread it more easily? And the second question, could a faster spread be a breaking point for some of our hospital systems? Because they're in bad shape out in California.
Well, they are in bad shape, and anything that makes that worse is something to worry about. The data on this is still pretty fresh. This is certainly a strain that has emerged in the United Kingdom, particularly around London, where it rather rapidly became the dominant strain of the virus. And it tells you that it's probably pretty good at spreading, or it wouldn't have been able to outcompete all those other viruses that are its siblings. Does it actually mean that it spreads more rapidly from children? That data is still very new, and I'm not sure we could be confident about it as yet. But this is not to be surprised by. RNA viruses change over time. This is an RNA virus. This happened already once before. That original Wuhan virus, you can't find that one anymore because it picked up another mutation on the way to New York. And what's replaced it is something that's a bit more contagious. Yeah. That's how this works. The bottom line is we all have to take responsibility more than ever not to be the one who catches it and super spreads it, which is all the more reason in these dark weeks we're going to have to practice mask wearing and distancing and washing your hands and all the things people are tired of, but we cannot step away from right now.
Must wear the mask. I try to treat it as like a piece of jewelry. You know, it goes with me everywhere, and I'm learning to love it. One more thing. You just made a point that seems like it's prescient. The viruses mutate. It's what they do. They always have. It's like the flu. It mutates every year. We get a new vaccine. Is it your belief, if we're talking straight about this, that this virus could be with us for decades, and we're just going to have to learn, just repeatedly get vaccines, and maybe for a long, long time, we're just going to have to act like this?
I think it would be naive to assume that this is just going to be gone by the middle of 2021 and we'll never see it again. This virus has been very successful, and it's not about to give that up. And over the course of time, it will change a bit. We may need an updated version of the vaccine in a few more years. Think of this more like your tetanus shot, where you need a booster now and then, as opposed to something where you do it once and you're done.
Shepard Smith here. Thanks for watching CNBC on YouTube.